baby blues. So, baby blues, totally normal. Everyone gets them. You got 2 weeks. What happens if it goes longer? Well, if it's after 2 weeks and you have those depression symptoms, remember, SIGI CAPS, sleep, interest, guilt, energy, concentration, appetite, psychomotor problems, and suicide, 5 of 9, then you call it major depressive disorder with peripartum onset. You can't really call it major, if it's within the first 2 weeks, you can't really call it MDD with peripartum onset, unless of course you have all the depression things. Usually on a question, they'll make it really simple. They'll just say, oh, I'm feeling sad, I don't know if I'm fit to be a mother, that kind of stuff. And you have the new mother who's talking to the nurses and saying, am I fit to be a mother? I'm feeling sad, I'm feeling blah, blah, blah. And it's a few days after. That's just blues. Everyone gets a bit down, all right? Happens to everyone. With major depressive disorder, though, if they're going to put it within 2 weeks to try and trip you up, it'll be very obvious that it's major depressive disorder. This person's not sleeping. This person hasn't been eating. This person has no interest talking to her other children. Right? This person has such low energy. They're not able to think clearly. Blah, blah, blah. All right. And then postpartum psychosis. They can happen at any point. Okay, this isn't the postpartum blues versus peripartum major depressive disorder. Do I have to care about 2 weeks or not? Postpartum psychosis can happen at any point. And the question's always going to say, oh, Mary's been thinking of getting rid of the child, throwing it out the window or something. You see that, bam. You immediately know it's postpartum psychosis. They love testing you about electroconvulsive therapy. Grief. Even in step 1, you can't get away from dabbing. The big thing here is that it can happen in any order. There's that famous Simpsons clip where Homer goes through the entire stages of grief, but it doesn't have to be in the denial, anger, bargaining, depression, acceptance order. Now here's the thing. They're going to test you on normal grief versus complicated grief and persistent complex bereavement disorder. It'll typically be with someone who just lost their long-term spouse. So a woman just lost her husband. They've been together for 70 years, okay? And she goes to the doctor and says, I'm still hearing, I feel like I'm hearing his voices or something. Like he's telling me, oh, I love you or something. Am I going crazy? What's going on? No, you say, no. Like, it's very common. This can happen for around 6 months or 6 to 12 months, And sometimes you think, oh, I don't know, I feel like I want to be with him or something. Okay, I mean, that's a little strange, right? It should kind of get you thinking, does this person have any sort of signs of major depression? If they're thinking about suicide. But if it's just to join their dearly departed, then you don't get as worried about it. Now, if they think about dying because life's not worth living anymore, and, there's nothing keeping them here and the world would be better off without them, then it's not just normal grief. And here we have persistent complex bereavement disorder. Again, this is when you have your normal grief stage lasting more than the 6 months, the 12 months. Here it's lasting about a year. Make sure, though, that it's not major depressive disorder. Electroconvulsive therapy. Safe in the pregnant and elderly. You do see this in elderly patients. And depression with psychotic symptoms. Even in elderly, you see this a lot. So don't get confused, or don't get thrown off or something. Suicide completion. I like how they started. Maybe I'm just noticing it now. They started saying completed suicide instead of just killing themselves or something. The biggest risk factor is the previous attempt. Whenever you screen someone with SIGI CAPS, I always throw in any access to guns. All right. On a test question, they're going to test you on these two things more likely. They're going to say, oh, here is a 90-year-old man, wife recently died, so he's depressed, he's an alcoholic, not thinking straight, isn't in good health, has said he's planned on it before and he has access to a firearm. And they're going to ask you, well, what's the biggest risk factor? It's the previous attempt. It's always the previous attempt. It doesn't matter if he has access to guns. Yeah, that increases the chance of him going through with it. The biggest risk factor is a previous attempt. And I think this is funny here. Women try more often, but men are more successful at it. It's kind of funny. And on to anxiety disorders, where it's not attributable to something else, like hypothyroidism or substance abuse. And remember from before, the child under 5 years old with selective mutism comes back into play here.